Hey there, beautiful people. My name is Sten, and today I am 5 days on testosterone. I realized in the last video I never actually said, hello Skittles. I never actually told you guys my dosage or anything like that, so I figured maybe I should talk about that. Basically, my dosage right now is 0.25 milligrams per or something like that. So I'm doing 0.25 in the syringy thing, and I'm doing that once a week right now. And then my next appointment with my doctor is in January. So up until then, I'll be doing those weekly injections of 0.25 milliliters. As far as any changes, there hasn't been a whole lot. Right now, there's been some downstairs growth, and I've also noticed that my voice, I don't think my voice has actually gotten lower, but I feel like whereas before I had to make a conscious effort to go lower, now it's just kind of naturally going towards a lower vocal range. So maybe that's a thing. I'm not sure. And it might just be my imagination and me just like staring at myself in the mirror every day, because I do that. But I almost feel like I've got a bit of a happy trail developing. You'll see pictures and stuff eventually about that one day. But anyway, so that's the thing. And also, as far as costs for testosterone for me, it got like $30 off for my insurance, which meant that I spent about $90 if you include the needles. The needles were like $11. So I suppose I spent like $70 or $80 on testosterone, which is not that bad, because what I got were these little vials that the pharmacy swears are single-use vials. The nurse was like, no, they're not single-use vials because they contain 1 milliliter in them, and you take 0.25, and so basically each vial is going to last me a whole month. And I got 4 of those vials, which means I have a 4-month supply with my needles. That's $90 for 4 months. Not bad at all. Okay, so update on my top surgery situation. Today I visited Dr. Stanwix of Richmond, Virginia. He is a different plastic surgeon than the one I met on Monday, which was Dr. Zinzer. Dr. Stanwix does not charge for a consultation fee, so straight up, that's the first awesome thing about him. I met with him, and there was no drawing on me like with Dr. Zinzer. There was some discussion about, what I had already looked into as far as costs and as far as what other doctors I'd seen and what I actually knew. He wanted to make sure that I was educated about the decision I was making before he even got into telling me anything about the procedure itself. So that was awesome. And then I brought up that I have Behçet's disease, which is an autoimmune disease, and it's kind of rare. Hello Skittles. See you later. Behçet's disease is becoming one of those things that more and more people are realizing they have it, and I think it's a case of there's a lot of people who are misdiagnosed or just don't know that they have it. But either way, the biggest thing that impressed me about him was he has heard of it before. He has heard of Behçet's disease. You have no idea. I actually carry around these little cards with information on them to give to doctors, because it is so hard to find doctors that actually know anything about Behçet's disease. So that was impressive. However, because of that, he was real honest with me. I wanted to see if I could get periareal or, around the nipple as opposed to going underneath. And he was straight up saying there's a huge risk, because part of Behçet's is there's vasculitis, and that means that there's a possibility I could lose my nipple, and that would not be cool, losing my nipple. So he recommended double incision. So he showed me some pictures. He didn't have as many as he normally would, because he said that there was an iPad issue, basically. So he had to use his laptop to show me some of the pictures, and most of them were periareolar pictures, just because he wanted to show me, just in case something happened, and he wanted to show me what it looked like and everything, but he did show me some of the double incisions he's done, and based on the way he talked about it versus where Dr. Zinzer was very much like, I don't like this about my surgeries, I don't like that about my surgery, I did a revision here, I did a revision there. In this case, Dr. Stanwix was like, I do revisions in my office, I very rarely ever have to do anything in a surgical suite. And he gave me the overall impression that he didn't have to do revisions very often. And he gave me the overall impression that he was satisfied with the results and that his patients were satisfied with his results. And even looking at just even the 1 or 2 pictures I've seen of the double incision that he's done, the scars look a lot cleaner, which is a big deal. Now, the other big deal is that he does liposuction. Not a lot of doctors also do liposuction on top of the top surgery, or at least they don't even mention it. Dr. Zinzer did not even mention it. I imagine that I've heard that Dr. Garamoni does some liposuction, but he's in Florida, so that's a problem for me. And now, on to the costs. Basically, he said that I would get an email and then a call later from the person who does all of his cost stuff. And so when I got my call, I was quoted at about $7,200, which that includes anesthesia and the actual surgical fees. That includes visits for a year, and like he said, the revisions are free. Basically, it included everything. So that being said, that's a lot cheaper still for top surgery than it could be in other places. And also, Dr. Stanwix's practice does participate in the 12-month no interest financing for care credit. I think that this is the doctor I'm going to be going with. I feel that way because I just felt more confident with him. I felt like there was a lot less unsureness and the cleaner looking scars and the pictures and everything. And I'm willing to pay a little more in order to have a better result, and I appreciated that he was honest with me about my options. So that's probably why I might end up going with him. Now, here's the next part. Today I got my STP in the mail. If you don't know what an STP is, it's a stand to pee device. In this case, mine is an STPP, which is a stand to pee packer, which can also be used for pleasure, so it'd be like an STPPP, I think. Either way, I don't intend to use it for pleasure, but basically my STP, I got the Peecock, the newest variant of the Peecock, and if you don't like what penises look like or anything like that, you're about to see that, so you might want to turn away or just not watch the video anymore, because the rest of this video is going to be all about my fake penis that I used to pee standing up. So anyway, this is the bag it came in. Can you see that? Hang on. This is the bag that it came in. Peecock products. The packaging was discreet. In fact, I have it right here. This was the packaging. I think it's backwards on the webcam, but it's also upside down because I'm holding it upside down. But it didn't say anything about, it doesn't have anything on here that would, in fact, it says, it's the detailed description of the content was novelty item toy. It's discreet. You don't have to worry. It doesn't say anything about sex or penises or anything like that, so it's discreet. There's no worries about, getting it sent to your house and then, somebody picking it up and being like, what the hell is this? And then even then, you have it in this nifty little bag here. Hi! So here's the part where you might want to avert your eyes if you don't want that. First off, has the instructions and stuff in here. Yay, paper. And then here is the good stuff. Oh wait, before I show you the good stuff, also some of the other stuff that they gave me. I got some Carex condoms and some Carex lubricating jelly, just in case. Anyway, my peacock. This is it. This is my peacock. I understand that this pinkness is gonna go away, because every time I wash it, it's gonna be a little bit more faded, which that's not a problem for me. It might be a problem for some other people. But basically it feels very squishy, and it's not hard or anything at all. If you look in here, this is like the cup. This is where you pee in. Yeah, and this is the smallest size that they have. This is the smallest size they have. Like, anything beyond that to me would be kind of horrifying. So anyway, I did try peeing with it today. They have instructions, and I just dropped my Peecock bag. They do have instructions about how to pee with this. Basically, it involves, you have to kind of hold it underneath your junk, and you have to push this back against it, and then you have to really control your pee when you go, because otherwise you're gonna do like I did, and it's gonna go out the back here, and it's gonna get into your boxers, your boxer briefs, or whatever undergarment of choice you have. And also, you also have to like lean forward, otherwise, you know, it's just gonna back up in here, like I said. But that being said, I would say that it was still at least a partial success, because I didn't leak that much at all, actually. And I did pee. I did get some on the toilet seat, admittedly, but that's because I had no idea how to deal with it once you get to the point where you're supposed to kind of jiggle and move this so that you get all the rest of it out. Yeah. But anyway, that's my Peacock. So far I'm actually really satisfied with it, and as far as packing is concerned, you can actually pack with it. The Peacock company actually says that you can pack with it with, slim boxers, slim, boxer briefs, whatever. I'm trying to do that, and I haven't done it for a full day yet. I could see how it's possible, but I could also see how it might jiggle around a little bit. So tomorrow I'm going to work with this in my pants. And we will see how that goes. Now, there was one more aspect, and I dropped the bag, like I said. This is the pleasure insert. So if you're the kind of guy that's interested in that, or them, or they, whatever your pronouns are, then basically you have this little insert here that I can't show to the camera correctly, and that just kind of sticks on up in here, and you're just doing your thing. It's why the condoms and everything came with everything. I don't see the appeal in using it. I can understand why some people might, I guess, but in my case, I'm not gonna be using this. So, anyway, so that's it on the Peacock. Basically. So be prepared to see the next update on Monday, because that will be my official 7 days on T video. And it will also be a better, there will be more of an update as far as, actual T effects versus STPs and top surgery stuff. So there's that. Oh yeah, I shaved today. I'm gonna say goodbye to all you beautiful people, and see you next time.